Hello, everyone. How's everyone doing? My name is Chrislene Mariano, and I am a pediatric nurse practitioner. I am currently the employee health nurse for the Southern Nevada Health District. Today, I will be discussing about the monkeypox disease. Our objectives during this presentation will be to review and discuss about the monkeypox disease, understand the different types of monkeypox, know the signs and symptoms, review general information, understand the rash and the anthems. We will also be discussing how monkeypox is transmitted, how to test for monkeypox, and also we will be discussing about the prevention as well as the vaccine of Jynneos. We will conclude with questions and answers. The monkeypox disease is an infection that is caused by the monkeypox virus. It is within the same family of the variola virus, which also causes smallpox. Although it is very similar to smallpox, the symptoms of monkeypox are milder, and monkeypox is rarely fatal. Monkeypox is not related to the chickenpox virus. It was first initially discovered in 1958 with two outbreaks of pox-like viruses that occurred in two colonies of monkeys that were kept during research. And despite it having the name of monkeypox, the source continues to remain unknown. It is said to be that African rodents and non-human primates, like monkeys, might harbor the virus and infect people. The first human case was first noted in 1970, and prior to this 2022 outbreak, it has been reported in several countries of Central and Western Africa. There are two different types of monkeypox. The first is clade 1 and the second is clade 2. The current outbreak appears to be that is clade 2, and more specifically, it is clade 2B. Approximately 99% of people who are infected with the clade 2B are likely to survive. However, people with immune systems that are weakened, children under the age of 8, and people with a history of eczema or are pregnant and breastfeeding may become more seriously ill. The clade 1 monkeypox virus has a fatality rate of approximately 10%. The signs and symptoms of monkeypox include many, and there are several different types. The first is that a person would probably get a rash, and it is typically located near or upon the genitals, which include the penis, testicles, vagina, and labia. It can also be located towards the anus. Other areas that it might appear include the hands, feet, chest, face, or mouth. The rash will go through several different stages, and it will include different times of healing, and it will also include scabs. The initial rash will look like pimples, or it may possibly even look like blisters. It is said to be that these pimples or blister-like rash can be painful and itchy. Other symptoms that are also included with monkeypox include fever, chills, swollen lymph nodes, exhaustion, muscle aches, headaches, backaches, and respiratory symptoms. These respiratory symptoms can be very similar to that of the flu or COVID, which includes sore throats, cough, nasal congestion. Here are some key characteristics for the monkeypox rash. These pictures provided were from the CDC. The lesions can be very firm or rubbery, well circumscribed, and deep-seated, and often they have an umbilication where it resembles a dot on top of the lesion. This current outbreak, the lesions often occur in the genital or the anal rectal areas, and it's not always disseminated across many sites of the body. It can be also located to the hands, feet, chest, mouth, and typically anywhere on the body. It can be from one lesion to multiple lesions, and it doesn't always have to occur on the hands and the feet. Rectal lesions tend to be more purulent or occur with bloody stools. There's some rectal pain and rectal bleeding. As previously noted, that these lesions can be very painful or very itchy. The fever or the prodromal symptoms, which include chills, lymphadenopathy, malaise, myalgias, or even headaches, can occur before the rash occurs, and it can also not occur during the rash. These lesions typically develop simultaneously throughout the body, and it can be on any given part of the body. The lesions go through several different stages, and can also occur during the same time. Initial stage is macular, which proceeds to papular, and then it possibly goes on to a vesicular and ends with a pustular-like rash. Scabbing occurs and then desquamation also then occurs. The incubation period for the monkeypox is approximately 3 to 17 days. There are times that people who do get the monkeypox may or may not have these symptoms and feel fine. Typically, the illness lasts approximately 2 to 4 weeks, and the symptoms can vary from person to person, and it's dependent upon the initial health of that individual. The stage of the ananthem or the rash ends with the scab. Ananthems or the lesions first form and can form on the tongue or the mouth. It will spread throughout the body, and it can occur in several different stages and several different stages of healing. The first stage typically is the macular rash, in which it occurs within the first 2 days. These lesions tend to be more flat in nature. It can also be papular, which is more raised in nature. It also will proceed to a vesicular rash, which also can occur within the first 2 days. These vesicular rashes or lesions can become more raised and filled with a clear type fluid. A pustule lesion is a lesion that is filled with an opaque like fluid. Typically, with a pustular lesion, it scabs over and forms desquamation. These pustular lesions remain for approximately 5 to 7 days. The pustular lesions continue to be contagious until they are fully scabbed over, which typically can occur anywhere from days 7 through 14. However, it can last up to 21 days or more. The severity of the illness can depend upon the initial health of the individual and the route of exposure. The West African virus genetic group, or clade, which is the current one in this current outbreak, is associated with more milder symptoms and fewer deaths than the Congo Basin virus clade. Here are some photos that have been shared by the CDC of what the rash may appear to look like. As you can see, it is just not generalized to one area. It can happen on many different surfaces of the body, including the chest, the back, the hands, the feet, the mouth, the fingers, the toes, and all parts of the body. The monkeypox virus can spread in many different ways. It can be through close or intimate contact, direct contact, or other ways as well. For close and intimate contact, it would be for someone close, personal, and often it's more skin-to-skin contact. The direct contact would be with the rash, the scabs, or bodily fluids from a person who is infected with the monkeypox disease. There's a possibility that touching objects such as fabrics, clothing, bedding, and towels may also cause transmission of the monkeypox virus. However, the other person would have to have some kind of contact to those bodily fluids. Contact for respiratory would be considered anything longer than 3 hours. Direct contact during intimate contact include oral, anal, vaginal sex, or touching of the genitals or the anus of a person who is positive for monkeypox. It can also be transmitted through hugging, massaging, or kissing if that patient or person has a positive rash and an open wound. It can also be transferred from mother to baby. Other ways that it can also be transmitted: it is possible for people to get monkeypox from an infected animal, either by a scratch or being bitten by an animal that is positive for monkeypox, or preparing food or eating food using the products from an infected animal. There still continues to be some research regarding the transmission at this time. So when should somebody get tested? Currently, testing is only recommended for those if you have a rash that is consistent with the monkeypox. If you think you have the monkeypox or have had close contact with somebody who has had the monkeypox, please consider taking precautions, visiting your healthcare provider, and getting tested as referred. So we have heard that prevention has always been key. So let's review the different types of prevention that we can utilize to help prevent the transmission of the monkeypox disease. So prevention and protection are always key. We have to protect ourselves and protect others. Although that at this time that the data shows that gay, bisexual, and men who have sex with other men make up the majority of the cases of the current monkeypox virus outbreak, it is still recommended that anyone, regardless of sexual orientation or gender identification, or anyone who has been in close contact with someone who has had monkeypox, are still and considered to be at risk. It is encouraged to avoid people who have a rash and do not touch that rash, especially if you come in contact with any bodily fluids. If the rash is open, please consider do not touching the rash, especially if you have an open wound as well. It is also considered and recommended to avoid sharing any utensils, cups, spoons, forks, and other products. It is also recommended that we wash our hands appropriately, wash with soap and water, or if we have no soap and water, please consider utilizing some hand sanitizer with an alcohol base. Vaccination is also another way key for prevention. Currently, the CDC recommends that vaccination for people who have been exposed to the monkeypox or with people who have been diagnosed with monkeypox are more likely to get monkeypox. So it is highly recommended at this time for those to go ahead and get vaccinated. Those who are included with high risk include those who have been identified by public health officials as a contact to someone with and diagnosed with monkeypox, those who are aware of their sexual partners who in the last 2 weeks have been diagnosed with monkeypox, and those who've had multiple sex partners in the past 2 weeks in areas that are known to have a high incidence of monkeypox. People with jobs that expose them to an orthopox virus are also considered to be high risk and recommended to receive a vaccine at this time. Laboratory workers who are testing for orthopox, or those who are utilizing and handling any cultures or animals with orthopox virus are also highly recommended to receive the vaccine. There are also some other considerations, and those are that who are designated by healthcare and public healthcare workers. The other mode of prevention is providing the vaccine to protect against monkeypox. The current vaccine of choice is Jynneos, and it is considered for those who are determined to be at risk for the infection. It is currently licensed as a two-dose series. It is provided 28 days apart or 4 weeks apart. Currently, immunity will be received after 2 weeks of the second dose. However, duration of immunity continues to remain unknown at this time. There are two different regimens for this vaccine, the standard regimen as well as the alternative regimen. The current recommendations for the standard regimen are those for who are under the age of 18, and it is provided and administered as a subcutaneous dose, zero point 0.5 mLs. It is currently authorized by the Emergency Use Authorization. The second recommendation and alternative a dosing regimen is the alternative regimen. It is an intradermal version of zero point 0.1 mLs, and it is for those who are 18 years of age and older. Provided here is a vaccination schedule and dosing regimen table. Dosing intervals, recommended intervals. The second dose should be given 28 days after the first dose. And based on current clinical studies, the second dose may be given up to 7 days later than the minimum interval of 28 days. This will place us at approximately 35 days. The minimum interval, our considerations are as advised. Per the manufacturer, it advises against giving the second dose before the 28-day interval. However, according to the ACIP, a dose may be administered 4 days prior to the minimum interval of 28 days. This is also known as a grace period. This will place it at a minimum of 24 days after the first dose. Vaccine doses should not be administered earlier than this. Nevertheless, if a second dose is inadvertently administered before the minimum interval, the dose may not need to be repeated. The maximum intervals, if a second dose is not administered during the recommended interval, it should be administered as soon as possible based on ACIP's general best practices. There is no need to restart the vaccination series again. Now that we have discussed the possibilities of administration of the vaccine, it can be given in one of two ways. The first way is the subcutaneous version, and which is the standard regimen. It is provided as a subcutaneous vaccine at approximately 45-degree angle. The second is an intradermal version in which it can be administered approximately 5 to 15 degrees. Intradermal administration involves injecting the vaccine superficially between the epidermis and the hypodermis layers of the skin, and typically it's on the volar aspect, or also known as the inner side of the forearm. At the end, we should notice that there is a pale elevation to the skin, which is a wheal. I have provided pictures from the CDC on how to administer the vaccine intradermally. Step 1. First, we should locate and clean the site for injection, which is typically noted within the volar aspect or the inner surface of the forearm. The second step is to pull the skin taut and position the needle with the bevel up, and insert the needle at approximately a 5 to 15-degree angle into the dermis. Here is another version of step 2. And again, while pulling the skin taut, we position the needle bevel up and insert it approximately 5 to 15 degrees into the dermis. Step 3 is to slowly inject 0.1 mLs intradermally. Once you have done this, you should be able to notice that there is a pale elevation on the skin, which is also known as a wheal. Step 4 completes the process in which you have to observe the patient for approximately 15 minutes after the vaccination. Or, if the patient has any anaphylaxis to gentamicin, ciprofloxacin, chicken, or egg proteins, we would consider and monitor them for approximately 30 minutes.
How to administer a vaccine intradermally. Locate and clean a site for injection in the inner or volar surface of the forearm. While pulling the skin taut, position the needle with the bevel facing up and insert the needle at a 5 to 15 degree angle into the dermis. Slowly inject 0.1 milliliters intradermally. This should produce a noticeable pale elevation of the skin or wheal. Observe patients for 15 minutes after vaccination, or 30 minutes if they have a history of anaphylaxis to gentamicin, ciprofloxacin, chicken, or egg protein. Learn more at cdc.gov/monkeypox.
Currently, there are no data on administering Jynneos vaccine at the same time as other vaccines. Because Jynneos vaccine is based on a live attenuated, non-replicating orthopox virus, Jynneos is typically administered without regard of timing to other vaccines. This includes the simultaneous administration of Jynneos and other vaccines on the same day. However, it is highly recommended that if we are administering the vaccine, to consider different anatomical sites. There are some considerations if you are administering the COVID-19 vaccine. If an orthopox virus vaccine is offered for prophylaxis in the setting of an orthopox outbreak, the orthopox vaccination should not be delayed because of recent receipt of Moderna, Novavax, or Pfizer. There is no minimum interval between the COVID-19 vaccination with other vaccines and the orthopox virus vaccination. In providing the vaccine, we would always like to educate our patients pre and post vaccine. Patients should be informed of the side effects as well as the risks and the benefits. We should obtain a health history to determine which route the vaccine should be administered, whether it should be provided intradermally or subcutaneously. Remember that if we're providing an intradermal vaccine, the patient should be 18 years of age or older, and if we are providing it subcutaneously, a patient should be under the age of 18 and have a history of forming keloids. Also, they should be counseled about the possible side effects from the vaccine, which include injection site pain, redness, swelling, induration, itching, fatigue, headaches, nausea, chills, vomiting, muscle aches. We can also provide them with the emergency use authorization. Regarding post-vaccination counseling, we would encourage the patients to continue to protect themselves against any infection. Also, to remain hydrated, obtain and take some antipyretics as needed, and also remind them of the possibility of myopericarditis. So what are the contraindications and the precautions regarding the vaccine of Jynneos? People presenting with illness that are minor, such as a cold, may be vaccinated. People who are moderately or severely ill should wait until they have reached their baseline health prior to the vaccine. A person is offered Jynneos vaccine due to an exposure of the monkeypox virus or the disease, and they should be vaccinated regardless of concurrent illness, pregnancy, breastfeeding, or any weakened immune systems. Vaccine providers, particularly when vaccinating adolescents, should consider observing patients with patients seated or lying down for approximately 15 minutes after the vaccination has been received, and this should decrease the risk for injury should they faint or if they have any syncopal episodes. Here is another overview and table to help assist for any contraindications and precautions. So, if somebody has an allergic reaction to their first dose, it is contraindicated to vaccinate this patient. Please refer these patients to an allergist or an immunologist. If they've had a severe allergic reaction to gentamicin, ciprofloxacin, or are watching what they eat as far as chicken or any egg products, then we would provide guidance and inform them with precautions, discuss the risks and benefits, vaccinate the patient, and observe them for approximately 30 minutes. The other option is to also not vaccinate the patient and refer them to an allergist or an immunologist. The other precaution is if the patient has any type of moderate to acute illness. And if they have any moderate to severe illness, we would consider deferring the vaccination until they have reached their acute illness phase and have improved. Vaccination providers who are administering the Jynneos vaccine under the emergency use authorization are required to report all of the following adverse events that occur after receiving the vaccination. Vaccine administration errors, whether or not associated with an adverse event, or serious adverse events, or cases of cardiac events, including myocarditis and pericarditis, and cases of thromboembolic episodes and neurovascular events should be notified to the vaccine adverse event reporting systems. They can be notified at 1-800-822-9767 or an email to https://VAERS or VAERS .hhs.gov. Thank you for listening to my presentation. If you have any questions or concerns, please feel free to contact me at any time. My name is Crystalline Mariano, pediatric nurse practitioner, current employee health nurse for the Southern Nevada Health District. I can be reached at 702-759-1044, or you can email me at employeehealthnurse@snhd.org. Thank you and have a wonderful day.